Good afternoon, Legislative Information.
At the State House, the phones were ringing.
You'd like to know about the medical marijuana?
Judy St. Pierre says she had fielded about a dozen calls by midday.
Everybody wants to know if they can set up a distribution center. And one gentleman called and wanted to know, could he start growing his marijuana now? And I said, I didn't think so.
Even the governor's office was getting calls. Maine has allowed the use of medical marijuana for about 10 years, but Tuesday's vote approves the creation of a distribution system so people can more easily get the pot they want.
For the state, this now becomes a pretty complicated assignment. It has to create a system of private dispensaries, basically nonprofit businesses that will be licensed to buy and sell marijuana.
The Department of Health and Human Services will help lead a special task force to plan the dispensary system.
How many they are, where they are, who they are. I mean, there are some general...
And more than that, including where they'll get the marijuana.
How do we regulate the supply arm or end of this? We can perhaps figure out how to regulate the dispensing, but how does it get there? What does that look like? What are the parameters that allow for, public safety?
The sponsor of the referendum says it should be simple. Jonathan Levitt told us by phone he'd like to see the dispensaries themselves also be the growers. But marijuana is still an illegal drug, and law enforcement agencies worry how growing and selling it will be regulated. And then there are the doctors, allowed to prescribe FDA-approved drugs, which marijuana is not.
I would not advise a physician to write anything about marijuana on a prescription blank.
Andy McLean says he'd like doctors to also have a seat at the table. As government tries to implement a law it didn't really want, but the voters did. In Augusta, Don Kerrigan, News Center.